So, okay, good.
Okay, you can go on.
Mm.
And people are trying to come in from my
Yes,
side. I'm admitting as well.
okay, okay.
Okay, so
Sorry, Dr. Abdulkader, I don't know, do I have the permission to also share my screen?
Yes, everything is set. You are a co-host, so you can go ahead.
Okay,
And
okay.
yeah, but
Let's start. We need to
wait,
really introduce.
yeah, wait. Let's start first. So
Yes, we're going to start from the host. Let's do
yes,
all the preambles. Maybe Abdulkader does the preambles, sent to Mubarak,
No,
and we continue from there.
no, I think Mubarak can go on directly.
Okay.
Okay. Hi, everyone. Good morning, good afternoon, good evening from wherever you are. Assalamu alaikum wa rahmatullah. Welcome and thank you for joining Gamji Educational and Mentorship Forum Lecture Talk. My name is Mubarak Muhammad and I'm from Jigawa State, Nigeria. And currently I'm PhD neuroscience candidate in Konkan University, Thailand. I'm also one of the mentors in Gamji Educational and Mentorship Forum, and I'm going to be your host. I would like to encourage you to feel free to make this session interactive via our social media platform. There is also going to be Q&A session after the lecture talks. Speaker today is Dr. Bashir Bello. Dr. Bashir Bello is an associate professor of physiotherapy at Bayero University, Kano, Nigeria. He's also research fellow, lifestyle disease, Northwest University, South Africa. He originally received his PhD in orthopedic and sport physiotherapy from the University of Ibadan, Nigeria. Throughout his career, his research focused primarily on musculoskeletal disorders, specifically trying to uncover the efficacy of physical activity in the prevention and management of low back pain. As his former and forever student, I'm so excited today that everyone get to experience the amazing talk of my mentor. Please help me to welcome Dr. Bashir Bello, and the title of his talk is Procedure and Process for Conducting Systematic Review. Take it away, Doc. The floor is all yours.
Yeah, thank you very much. It's my pleasure to see you guys again. You know, that's all we have to appreciate. Like they say, the reward of teachers is in heaven. But we as ASU members, we have said we want to take it both on earth and in heaven. So I think this is one beautiful aspect that I'm happy with, to see your mentees becoming mentors themselves. I think I want to appreciate these aspects of our lives, that we're still healthy and healthy and sound, to see our mentees growing up to become also mentors. I'm really happy and appreciate God for that purpose. Well, this morning we'll be looking into systematic reviews, and then we try as much as possible to see how we can squeeze everything within a short period of time. I will try as much as possible to make it as interactive as possible. Actually, if you don't interact, you miss a step, you're likely to miss every step. So I want to urge us to please pay attention for the little moments we're going to be discussing together. Please permit me to share my slide. Just give me some short time. Okay. Screen.
Okay, Doc, what we are seeing is your...
I don't think that is coming from me. Is it from me?
Okay, it's from you, Doc. We are seeing
really?
the poster of the presentation on your screen.
I think this is coming from Abdul Qadir. Abdul Qadir, you can remove it. Let the doctor share his screen.
Okay, I think we can all share screen. So let me just do this. Okay, just go to the first.
Okay, perfect, perfect, Doc. We are seeing your screen now.
Okay. Well, without wasting too much of our time, we'll go to the outline of today's presentation. And the first line, we want to see what is the meaning of systematic review and what is the benefit or advantages of this systematic review. Now, what is the process of developing a systematic review? And of course, under that process, we're going to be looking at the protocol registration. And we'll see, why do we have to register our protocols? Where do we go to register them? And then how do we register them? And at the end, who benefits from this registration? This will take us into going how to do the literature search itself, our study selection and screening, and then we're moving to use of the software that is called Covalence. Of course, that's another beauty of today's and tomorrow's presentation. You see some software coming up and what they've been used for. Of course, we're also going to be talking about how do we extract data and how do we manage this data in systematic review. And then we'll talk about quality assessment of these reviews that you have included in your study. And then how do you synthesize the data? So it's a whole lot. And I don't know if we can handle this in the next 45 minutes to 1 hour, but my fervent hope is we may have to have another time to come in for other things. Because if you see what I have here, it's just about systematic review only. But systematic review in some instances, especially if it's a quantitative type, is still not completed until you do what they call a meta-analysis. So you can see I have not touched anything about meta-analysis in today's presentation. So I hope as we grab more of these, we'll have reason to come in for another class subsequently. Now, as a way of introduction, to ask ourselves, what is systematic review? It has two terms, systematic and review. Of course, when you say something is systematic, it means it has a predefined plan. It has a fixed plan, which you have to follow. So this makes it differently from what other reviews are. Before you can start your systematic review, there must be something that you have planned. It has a priori plan. And of course, we look at the second term, which is a review. It's just a critical appraisal. Could be of a book, a play, of course, in arts, when you review a play or any type of work, it's a review. But an overall, in scientific basis, when you review something, it's about an overview of knowledge, which enables you to examine what have been done before. So this is just what those two terminology means. But systematic review is said to be something which is based on a clearly formulated question. You can't start a systematic review if you don't have a question that you want to answer. So this question for a systematic review must meet a predefined eligibility criteria. This is where we'll come to see later in our inclusion and exclusion criteria. And of course, a systematic review must be able to identify all evidence in that area you're talking about. And this is what brings us to the reason or the purpose of a systematic review. Sorry, at this juncture, I must have to make a disclaimer. In terms of systematic review, which I'll be talking about, it's all based on health and social care. I know I have some colleagues in engineering and some other parts. I may not be having that opportunity to be telling you what systematic review is in that aspect. Now, what really brought about systematic review in the field of medicine or health is about coming into the 2021 era, that is a new millennium of evidence-based practice. When we say evidence-based practice, is something that has been there since time immemorial. I'm very sure for the Muslims, we know that when you bring up an argument in anything, they said, Hatu burhanakum in kuntum sad, come with your proof. So in medicine, anything can work, especially if we know our system. Why is it that we kept taking different type of concoction, traditional beliefs, and so many things, and it does work. So will you ask people not to use it? He takes 2 leaves of baobab 3 and he got cured. But you say he should not do it because he has no evidence. So this is what science came about. And unfortunately, it has its advantage and its disadvantage. Because recently, we also saw what happened during the COVID period. Countries were developing different types of COVID vaccines, COVID treatment, but the WHO is there sitting back on their science, saying, if you cannot give us proof, then keep your medicine. I remember a country in Africa, is it Madagascar? They claimed they had this medicine that cured almost all of their patients, but WHO said, no, we don't want that. You have no proof. And we also, there's several types of concoction that went through COVID. Even before COVID, if you remember the Gisiri bathing, you know, when they said Ebola came in and people were bathing with salt, they call you early morning, hey, go, I mean, so many things to create vaccine. So these in science brought about the scenario that the highest evidence you can use to substantiate your claim for an intervention, for a therapeutic design, for a diagnostic design, or prognostic tool is that it must pass the level of a systematic review. So that is the highest level. I'm going to show us that in the field of medicine. The highest level of evidence is a systematic review and meta-analysis. So please, we must understand that systematic reviews must be able to identify all evidence before appraising it. Of course, you should be able to appraise the quality of those studies you have identified. Then you should be able to summarize this evidence explicitly using a method that has minimal bias. Because if I just want to say, okay, Mubarak 2020 showed that this intervention is effective, Abdul Qadir 2021 said it is not effective, and then someone also said there that this thing is effective. How am I supposed to know it is effective? If I'm going to set my rules, I know Mubarak is a wonderful guy. I know he can do something good. So I will choose Mubarak's on instead of that. I mean, there is no science behind it. And that is why you must have a scientific tool that will be used to appraise each of the study to give you the basis of your decision making. So, in a sense, we must understand these are reasons why systematic reviews must be done. Number one, it is done to minimize the impact of bias and errors in any study. Don't forget, we have a lot of biases that can be introduced, especially in randomized controlled trials or clinical trials. Somebody can choose to say, okay, I will select only certain type of population. And then when he's giving his conclusion, he will generalize. Already there's a selection bias. Somebody will do a study and just put everybody in equal grouping or whatever. I mean, there's bias in sometimes even reporting bias. He did an analysis, he kept the place that were showing not significant, and he's reporting only where it's significant. This is a reporting bias. So we must use a tool that can capture all these when we do systematic review. So this is one of the reasons to minimize the impact of bias in any study. Of course, they said systematic reviews can help us end confusion. I just talked about the confusion. Some articles are saying this intervention is effective. Some others are saying it is not effective. How do we end this? Let's pull all of them together and do a systematic review. It will give us where the direction is tilting to. Of course, Systematic reviews also help us to identify research gaps. Here, this is where there's no any health or social health student that will come for PhD without doing a systematic review, because it means you have not been able to identify what is left in that area you're looking at. It's only systematic review that will show you this is the gap in literature. So it becomes somehow, in most, like here where I am in South Africa, we don't allow you to continue your PhD without publishing a systematic review or a minimum of an integrative review in that area you're looking at, because it helps you to pull all this data and you see the gap. I remember most of my students back home in Nigeria, they will come with studies because they know what they see in our day-to-day clinic. They thought that is where the world starts and ends. You can't blame them. So they will come what has been known and has been done since almost 1 decade, 20 years ago. They will come, side effect of blah, blah, blah in paracetamol and this. You'll be wondering. The world has left you guys behind. So you cannot come back and be reinventing the wheel. It's going to be waste of energy, waste of time, and waste of resources. So what will stop this is your ability to do a systematic review, and you see what the world, where they are in that area, so you can pick it up from there. I hope I'm not rushing. I'm just trying to keep to time. Mubarak, am I okay? Can we continue at this pace?
It's perfect, Doc. It's going
Okay, thank
smoothly.
you. So another thing is systematic review helps us to contextualize our research project, especially, I said, for PhD thesis. Don't forget, PhD is your terminal degree. So we cannot give you a PhD, my professor will always tell me, without the rigor. And you ask him, sir, what is the rigor? He said, that is the depth of which your research should focus. You can't be touching the periphery of work and say you want a PhD. No, they won't give you. So when you do a systematic review, it will tell you the scope, the depth where the study can actually take you there. And of course, we said it helps us to mitigate the need for other studies. Of course, if already studies have been done and there's a direction where the conclusion of most type of studies are, why are you coming to do it again? And this brought us to a new field in clinical medicine that is called implementation research. I had an opportunity to do one of those implementation course in the US Vanderbilt Society. So now they have reduced the pressure on you to keep doing RCT or no, things that have been found. Systematic review have shown this is effective. But why is it that it is difficult to get implemented, especially in your locality? So they teach you how to do implementation research, come back, start using what has been known, and it helps us to not keep producing what has already been known. Now, I talked about evidence-based medicine at the beginning of my talk, and I said, it helps us to prevent unnecessary studies, because evidence-based medicine, it's about clinical judgment. What do you think about this patient or about this disease? What are the scientific evidence about the disease? Then you look at the patient's value and preference. What do the patient think about themselves? What do they like most? When you put all this together, is what will bring you into evidence-based practice. Now, for you to use any of the evidences, you have to go to where they call the hierarchy of evidence. And this is where we are. And you can see in medicine, the highest level of evidence is just where you put a little on the pyramid. You can see it's just few. And that is where you have a systematic reviews. It's the highest level of evidence you can ever produce in medicine. And another one from systematic review is the RCTs. From RCTs, you go to cohort studies, case control, and the list is when an expert in the field gives opinion. Unfortunately, when we are back home, and then we follow our professors for any clinical round or social case. Whatever the professor says is the highest of evidence. Until we came to scientific, to systematic review, we now realize that, oh, whatever the professor is saying is his opinion. That's an expert. But systematic reviews as the highest level of any evidence you will use to make informed decisions in medicine. Sorry, I just missed one aspect. See, when we're talking about what we have to do these systematic reviews, I said it's one of the tools we use in medicine to facilitate rational decision making. Now, this is very difficult for us back home in Nigeria to understand. The reason is we run an out-of-pocket medicine. The government don't take care of your healthcare bills. But in places like where I am, in South Africa, in the UK, in US, you run it by insurance. And the insurance company will not pay for a healthcare service in which they are not using the best of evidence. In fact, if you do that, they will take you to court, not only getting their money back and making sure that you lose your certificate for practice. So if you have systematic review, like my field is about low back pain. We all know low back pain is about something ubiquitous. As PhD students, I'm sure those who are just completing or trying to complete their PhD will tell you how much of back pain they have had over time because of prolonged sitting in front of their computers and of course working almost 24/7 on daily basis. So these are things very common. Now, when you have back pain and you visit the clinician, the first thing they do after X-ray, some of them ask you to do an MRI. You come up with the MRI, they say, no, you have a disc prolapse, or you have a disc protrusion, or you have a compression on your nerve roots. So they will tell you, we're going to do surgery. Now, the moment they talk about surgery, you're going to be paying a minimum of like 1.5 million naira back home in Nigeria. That's out of pocket. You pay. In the UK, US, South Africa, which I know, the insurance body will look at it and say, look, we cannot pay for that because systematic reviews have shown that conservative management is going to be the same with the surgical procedure. And in fact, the surgery is likely to get you even worse. So why do we have to pay that? So they will never pay you. But back home, the money is in the pocket of the clinician. So he asks you pay 1.5. The moment you pay, he cuts your back. And then you come back with some disability, you say, I say, take it out. So these are reasons why we'll have to do systematic review because it facilitates rational decision making in any case you're working on. Of course, healthcare providers, researchers, and policy makers are usually in need of this systematic review to inform policy, inform clinical practice, and of course, to even inform insurance disbursement. So that is why it's very important. And now don't forget, on daily basis, databases like PubMed or in the Medline have shown us that annually they have submission into the citation of over 20 million publications annually. So how many of you as a clinician are you going to read? You'll be able to do that to know the best decision. So when you have systematic reviews, then you'll be able to do that. They mentioned that a minimum of 75 to 100 articles are added on daily basis. So daily basis, how much time have you finished in the clinic or in the hospital? Now you want to read those 100 papers and make a decision. You can do that. So until somebody is somewhere there giving us a systematic review so that we can have all our information in one piece and make our decisions. So who undertakes this review? They talked about the Cochrane and Campbell collaboration. Now the Cochrane is an organization that is specifically devoted in publishing systematic reviews in healthcare system. While the Campbell collaboration is also an organization that is dedicated in producing systematic review for social healthcare system. So that's why they merged themselves into Cochrane and Campbell collaboration. These people continuously, this is just what they do. In fact, as young PhDs, sometimes you can apply when you have these skills in systematic review. They can give you opportunity to work with them. So it's a place that most people don't know they can get placement. Another regulatory bodies, like professional bodies, say in Nigeria, the NMA, the Medical Rehabilitation Board, all these boards, if they understand their duties, they must be engaged in systematic review so that they always have the best evidence at their top that will be used to regulate the professionals in the field. Of course, academics, researchers, and clinicians all need to do systematic review for them to keep themselves up to date. Now, most importantly, MSc, PhD student, we have mentioned them. You cannot ask an undergraduate to start systematic review because we are going to see how long it takes to do a proper systematic review. The candidate will have graduated while systematic review is there going on. We said usually a systematic review is carried out in a multidisciplinary team. Somebody cannot stand in silence to do a systematic review. And no any systematic review will be accepted or approved by an individual. Don't forget narrative review, integrative reviews, type of reviews, you will find only one person doing the review. This is not acceptable in systematic review, as you're coming to see as we move ahead. But the minimum standard is you need two persons, two independent researchers that will do a systematic review. In systematic review, the more the merrier. The more you are, the better you'll be able to do it if everybody can handle the situation properly. So you can see clinicians, health service researchers, librarians, statisticians, all getting involved during systematic review. According to a published work by Bora in 2017, he mentioned that the minimum estimated time to complete a systematic review project and publish it is a minimum of 67 weeks. So it means more than 1 year. So it's no joke. In 2019, of course, Baker also and his colleague, when they calculated, they realized that you need a minimum of 15 to 16 months to do that. So let's know that it's no joke to start and complete a systematic review. Back here in my institution and in the UK, where I also went for training, if a candidate who is doing MSc can publish a systematic review, it qualifies you for your graduation. So let's know how serious it could be. Now, these are now the key stages or the process for systematic review. So the first stage is that you must have a research question, clearly and unambiguously defined. You must be able to define a systematic, your research question, which you want to answer. The moment you have that, you go to developing the review protocol. After that, you move into identifying your relevant studies. How do you do that? It is how to develop a comprehensive search strategy. Then you move to assessing your eligibility criteria, talking about inclusion and exclusion criteria. And then we move into the data extraction or data checking stage. Now, at the moment you extract the data, then you will appraise this data for their quality and validity. This must be based on your predefined method. Don't forget, it is systematic because you have a method which you have already defined even before you start. So whatever goes out of that is not being used. Then you have to do what they call the narrative synthesis, that is data synthesis. When you bring your data all together, how would you narrate it? How many did you get at the end of the day? What are the characteristics of this data? And what did you find out in the data? So this is narrative synthesis that you will have to do. And then you translate the knowledge. So that is the data translation. What does it mean? All those things you have found. Are you telling us at the end of this day, you've been able to talk about the quality of included studies? Are they within high quality studies, moderate studies, or low quality studies? So these you must be able to translate eventually. So we go to the first stage, which is about formulating your research question. Now, the questions generally are said to be put in a funnel type shape. When they say funnel, it means at the top, it's going to be a generalized question. But you begin to narrow it down, bring it down onto the later aspect, which is the small aspect where it goes out. Then you have narrowed it down to a specific, a focal thing you want to look for. You can't be asking for a general term which you will not be able to get one answer to that question. So they said a well-formulated question will guide many aspects of the review. Because if you don't have a question, the main thing is you cannot even have the objective of the study. Now, if a study does not have objective, where will you find it? I remember just 2-3 days ago, a lecturer in one department in this South Africa was given my contact, and then she sent me that, oh, blah, 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 this is what she's doing, how can we handle it? And I asked her, what is your review question? Do you know for the past 3 days, we are still on the review question because she could not formulate it. So, and I say, if we don't have a review question, we can move anywhere. And she wants me to help. So that's the first thing. And that review question should be able to capture your searching strategy, the inclusion and exclusion criteria, the data extraction. So many aspects of the review you will see has to do with your research question. Now, there are two basic types of systematic reviews. Let me put it at this point so that we can understand. You have what is called the quantitative systematic review, and you have what is called the qualitative systematic review. To develop a review question, you must know what type of review you were trying to do. So there is this Pico model. In Pico, it tells you about the population, which is the P you're looking at, the I, an intervention, C, a comparison between the two intervention you're looking at, and an outcome you want to find out. So if it's a quantitative one, this is the Pico model you will use. If it's qualitative, you're also going to use a Pico where the C and O are matched together. Let me take you there, I will come back. So this is the Pico. You can see the C and O is a small O here, but the I, instead of an intervention in a qualitative study, is said to be a phenomenon of interest. It's a phenomenon you're going to be looking at. Why the CO, instead of comparator and outcome, no, here it stands for what is the context of that phenomenon of interest. So you can see we have two different things. Please let me just go back to the quantitative model. Now, in quantitative model, usually it's about an intervention you're looking at or a procedure. You know, you ask a question. Let me give an example. What is the effect of paracetamol over Feldene in the treatment of acute back pain or headache, something, maybe neck pain, anything? Now, among school teachers, that's my population. So I say, what is the effect of paracetamol over Feldene? Maybe I should not even call Feldene. I should say something like piroxicam. That's the IPAC name. You know, I'm looking at acetaminophen and then what? Piroxicam. Two interventions. But my concern is, what is the effect of a piroxicam over acetaminophen? Sorry, this clinical grammar, it can be big. Sorry, let me just make it simple. What is the effect of Panadol over Feldin, I think we all know Feldin. Maybe, what will I call it? Bruston N is what, Mubarak?
Peltri is okay. Peltri is okay, I think.
So we all get, we're just trying to look at two medications. Okay, what is the effect of Panadol over Feldin in the management of headache among school teachers? So my P, which is the population, is the school teachers. My I is the intervention. What do I want to see? I said Panadol. Then my C is a comparator. What am I comparing Panadol with? I said Feldin. And then what is the outcome in the management of headache? So management of headache must have an outcome. That is maybe pain relief, sleep quality, functional ability. So those are the outcomes I'm going to present. So for instance, I just want to look at pain, because when I say headache, is that my head is aching. I want to assess it with pain intensity, right? So this is quantitatively. I want to quantitatively say which one is more effective over the other. So I will pull all the studies together. So this is what they call quantitative Pico model. Now, in this quantitative Pico model, your interest could be a therapy, just like I talked about Panadol and Feldin. So that is an intervention, which is about therapy. Talking about the P is the patient disease. The I is the intervention, which is the therapeutic measure I'm using. The C is the comparator, which talks about what am I comparing with. And then the O is the outcome. Is it mortality rate, number of days of absenteeism? Is it pain? Is it disability? So with this is a therapeutic question I'm giving out in Pico. The same way, I can give a preventive Pico. For instance, what is the effect of a lifestyle change? You know, a lifestyle change intervention in reducing obesity among adolescents. So all I'm trying to do now is how do I prevent it? So you can see you bring about the patient risks or the general health condition or obese individual. Your new intervention, you're bringing either a preventive measure or a lifestyle change or medication, and then you want to compare it with another type, and then you want to see the mortality rate or number of those who are at risk of having that disease. So all this can be discussed. Another one is diagnostic. So you have a specific disease and you have two different diagnostic procedures. You want to see which one is more maybe sensitive in understanding that. Like when we're doing this COVID-19 test, they tell you there's this PCR, which can be more sensitive, but it's not specific. So when you're talking about this, you talk about sensitivity and specificity. So there's a gold standard in the PCR test, and then you have maybe you're trying to develop the quick kit. Those kits that just 1 minute I can test HIV if you are positive or negative, not necessarily doing the PCR. So all that, and of course you can do a systematic review based on prognostic factors. In prognosis is that the use of the particular intervention, how long can it go for somebody to get cured, or how many patients are likely going to be out of this disease, or how much do we think we're going to benefit from it? So all that can still be done, and it can also come in terms of causation, that is the etiological factors. So in all these, you realize that there are some of these components of Pico that are not applicable. Especially if I'm looking at prognostic or etiological factors, you will find out that there's no need for me to compare. I'm not comparing with anything. So usually they are not applicable. You just move ahead. So in qualitative, like I mentioned before, the population is the same, like the other population in quantitative, but the I Intervention is not usually, because qualitative means, for instance, you're trying to look at a healthcare system or a social system. So you can't be talking about intervention, but now is the phenomenon of interest. You see, I gave an example. I said an example of a review question for qualitative evidence, it could that reflects Pico could be, what is the caregiver's experience? You want to find out the caregiver's experience of living with and caring for a person with schizophrenia in the home setting. So if you look at this, my population is what? The caregivers. But the phenomenon of interest is that experience of the caregivers is what I'm trying to look for. And in which type of setting, the CO is home setting, not in a hospital setting, not in a rehabilitation setting, and not in maybe a rural setting. So it can differ. So please, we can see how your Pico, which of the Picos you should use, depending on the type of question you are coining. Let's not get this mixed up, please. Sorry, here is a lot of things I'm trying to put together in one page, is understanding your inclusion and exclusion criteria. Because the moment you have your question, all you need to start with is what type of studies will be included in this review. So I said your inclusion criteria refer to those primary research studies that were conducted with similar population, intervention, and outcomes that you are interested in studying. And this is the reason why we must have a predefined eligibility criteria. Because you cannot talk about it is when you are searching, you are now saying, okay, this study will be there, this study will not be there. No, you must have an inclusion criteria, which is based on what? Previous studies that follow the same type of population you are looking for, intervention or outcomes. I said for qualitative evidence, your inclusion criteria will not refer to analyzing and comparing those studies that explore similar population, phenomenon of interest, and the context understanding. I hope I'm not rushing, we can still continue.
Sure, Doc.
Yes, don't forget in your inclusion and exclusion criteria, you must also define the year limit. For instance, there is a recent systematic review which produced a guideline, mentioned that for a specific area of phenomenon, 5-year period is enough for another review to be conducted. That is, there is no harm for your argument for another review to be based on that for the past 5 to 10 years, or the past 5 years, there have been no review on that topic. And we know things keep happening every day. We mentioned that on daily basis, you have 75 to 100 new articles that are added to databases. So they mentioned that for every 5 years, you can replicate another review on that same subject. So what I'm trying to say here is, I will now talk about my inclusion criteria will be only studies that are between 2022 to 2018, for instance. It shouldn't be more than 5 years because I want to bring something new. So it's the same way. Even if that thing has never been done before, you can describe the edge, or you can say that this review will cover from inception to 2022 January, for instance. So you must put a year in your inclusion criteria. Of course, for the exclusion, usually it should be, we must understand that sometimes you will find articles that have your inclusion criteria, but you will need to exclude them because they have been contaminated with something else. And we normally call them their nuisance. Already you can see your inclusion criteria, but they did something that have contaminated that. So because you want a clean comparison, you have to take those studies out as exclusion based on your Pico, maybe P with the small o, or the big one. So I said exclusion criteria are very important to him to ensure that you have the same studies which you want to compare, which will help produce a very highly valid review.
Okay, sorry to interrupt, though. Sorry to
Yes,
interrupt. We are 15 minutes to an hour, so just so I
sorry,
just need to
I know
notify
that
you.
we just, okay, I think at this stage, we'll just calm down, and then can we just have 2-3 persons formulate some research question and let's have it. This is, whenever I do my physical workshop, this is the point I interact with everybody, some 2-3 people, just give us some research question based on either the Pico in quantitative or Pico in qualitative. Please, you bear with us for the next 5 minutes. Let's have some people interact and give us questions. Like I said, this is where the whole systematic review starts. Yeah, please.
Okay. Abdul Qadir, can you formulate one for us?
Yes, any person you can formulate in chat.
Yes,
and you
I'm
ask
trying
us
to put down one.
Yes.
Okay.
I will put one as well.
Yeah, please, Dr. Chutiami, you know that I followed too many of your work on ResearchGate, so I see no reason why you not. He publishes the systematic review almost on daily basis, you know. It's okay, please, can we make some few questions so that we can interact with those ones? And please feel free to make some contribution, maybe some things I've left out. Chutiami has about maybe 4 or 5 systematic review I've seen as well. Please, go ahead.
Sure.
Yes.
I think I'll put down on the chat box.
Oh, okay.
Okay,
You can read it out. You can read it out, please.
Okay.
While others are still writing.
A review
Okay,
of
let me read
fungicide resistance in Nigeria from 2010 to 2020.
Okay, let me see it. You say you put it down. I can't see it in the chat box.
Ah,
Can you
okay,
just
it's
take it
directed to
again?
Mubarak. Let me copy it down.
Okay. Okay, maybe Mubarak, you can read it out while he's copying.
Okay, it says a review of fungicide resistance in Nigeria from 2010 to 2020.
That's the title.
That's the title.
Dr. Abdul Qadir, give us the question you want to answer with that title.
Okay.
We just want to formulate a research question based on people.
Yes.
That is based on population intervention and the outcome and the comparator.
Yes.
And the outcome.
Yes, please.
I think maybe what I would suggest is maybe for the co-evidence section, maybe we're gonna do it maybe next time because time is very fast collapsing.
Yes, right.
So maybe we'll discuss it later and see whether we could get another time for the co-evidence session.
Okay. I'll be glad to continue. There's no problem with that.
Okay, I just posted another one.
Okay, it's saying what is the population of fungal pathogen resistant in fungicide in Nigeria?
Good. Now, Dr. Abdul Qadir, can you highlight the Pico for us? What is your P? What is the I? What is the C? And what is the O?
Okay. The P
The population. Population is what?
You can see it's a Herculean task. And that is
Yes.
why we don't want to move out of this side without understanding it properly. Maybe you can pass it to Dr. Chutiami to help you out.
Okay.
Even though he said he's trying
Where
to
are we? Sorry, So did we get an example?
Abdul Kadir just sent one.
Okay, can we see it in the chat?
Yes, it's on the chart. He said, what is...
He's struggling to give us the PICO. We want him to give us the P, the I, the C, and the O out of it. But
Okay, so where is the question? A review of fungicide resistance in Nigeria? Is that the question? Oh
no, the question is the second one.
What is the population of pathogen resistance to fungicide in Nigeria?
Population of fungal pathogen. So, so I will say population of fungal pathogen may be the population, and then the resistance, I think that will be the phenomenon of interest.
Beautiful.
Yeah, and then fungicide is the general field. So we wouldn't have a comparator here, obviously, because we directly want to see the resistance.
So,
fungal pathogen can be the population, and then resistance can be our interest or intervention.
Fungicide will be the intervention.
One colleague, Aisha, is just telling us, can we please go back to the qualitative Pico? Aisha, it is not the I that is small, it is the O that is small o. So it is are you talking about the quantitative Pico or the Pico with the small o?
No, she wants to see the slide, Pico slide.
Yes. Which of the Pico? Because with the small I saw there, it seems as if she's trying to be specific to one of it. If we can give her the opportunity to respond, please.
Okay, Aisha, can you talk, please?
I hope she's not muted.
Let me unmute.
Yes, please.
You can unmute.
Assalamu alaikum, Dr. Bello. I want you to go back to the slide with the small I, please.
There is no small I except a small O.
I actually thought I saw a small I.
Yes, there is a small O. So let's just quickly go back.
Yes, thank you.
Okay. Yeah. I'm sure, are you talking about this slide?
Yes, thank you.
Yes.
This one.
Beautiful. That's the slide Dr. Chutiami is trying to help put up the question raised by Dr. Abdul Qadir, talking about the population of pathogen resistance.
Yeah, I think I just put something. The P should be the fungal pathogen. I should be the fungicide. Outcome should be the resistance. And in this case, we don't need comparator unless you want to compare the resistance to something else.
Something else.
Compare the fungicide to maybe something similar to it. So we don't really need to have the comparator. So I will still go with the Pico in this case.
So the quantitative Pico, right?
Exactly.
Now we now have to go back to the primary owner of the work. And that's why conceptualization is key in systematic review. Dr. Abdul Qadir,
yes?
in the concept of this question you have raised, is it about you want to quantify, or you're trying to explore those pathogens? Which one are you really trying to do?
Trying to explore the pathogen, to know the population.
If you are trying to know a population, it's a quantification. It means you are trying to quantify.
Yes.
So it means you are aligning that thought with what Dr. Chutiami just told us now. Do you agree with him?
Yes, yes, of course.
So you have saved us now. It means it's very clear. What you want to do is that you want to find out, in that question, what is the population? How much do we have in this phenomenon you are looking at? So therefore, you will see that all your questions, your inclusion, exclusion criteria will be based on that Pico that Dr. Fitiami just raised. So please, we will have to come back to that. I'm going to take Dr. Fitiami's Pico too. He has a question for us, so we'll also use it. Meanwhile, I want to go back to what Aisha asked us to do, that she wants to see on the qualitative aspect. You see, the quantitative is much more easier to understand and follow, because the P is just simple. What is my population I'm looking at? The I is an intervention I'm trying to see. The C is a comparator. And let me say this, it's not necessary at every point you have to have a comparator. Sometimes even in the title, you may not need to put in the comparator, but during your inclusion and exclusion criteria, it can show. You are comparing with a standard, you're comparing with traditional treatment, anything you can talk about the comparator. But the qualitative aspect is the one that is a bit confusing. Most of our colleagues always think of Pico in a quantitative realm. But there are so many questions that will come, just like the example I gave here, in the CO, which is supposed to be a comparator and outcome in quantitative, is just the phenomenon of interest you're looking at here. And I gave an example of a question, which I said, what is the caregiver's experience of living with and caring for a person with schizophrenia in the home setting? So you will see that what I really want to look at, what I really want with the I, which is supposed to be an intervention, here it is my interest, the phenomenon of interest, is that I want to find out what is the experience of living with and caring for persons with schizophrenia. I don't know, Aisha, I hope I'm not confusing us again.
No, it's getting clearer.
Yeah, thank you so much.
Actually, thank you.
Yeah. So can we make progress?
Yes, sir.
Thank you. Dr. Chitiami, please, maybe you come up with another question so that we can easily follow to see how we can get another Pico.
Okay, so can we look at this? How effective is regular hand washing compared to social distancing in minimizing COVID infection?
A very beautiful question. Yes, a very beautiful question in this era of Corona. But thank God and thank the mercy that all the restrictions are being reduced or removed completely. You know, yeah. I read an article recently, and it said it's from Johns Hopkins University that if masking and washing of our hands have done anything good for us throughout the Corona period, COVID death, that it can only reduce as much as 0.001% of deaths due to COVID. Do we agree with that? Why? Because there were no clinical basis, there were no scientific basis of doing this thing from the beginning. Now, one of the arguments they posted in that Johns Hopkins publication is that what is the size of a virus? What is the size of mask that a virus cannot pass through? So you.
I think it's only like useful in terms of minimizing the droplet for somebody who is already infected.
That's just it.
Yeah.
And the argument,
but it wouldn't stop it completely.
What they say is, as long as you will continue to pick your phone calls, hello, and drop, that already, that phone you are taking home, already you have carried the whole virus on the phone before we reach in your house. So this question is very, very important. He said, how effective is regular hand washing compared to social distance, minimizing COVID infection. Okay, that is COVID infection rate among frontline health professionals. Now, can you give us the Pico in written in that box, please? The P, the I, the C, and the O. My point here is when you see efficacy or effectiveness, you know it's something therapeutic and it's quantifying. So we should know that we're going to be using the big Pico with the capital O. So this is a simple way of understanding where your Pico is going to, or the type of systematic review you're doing. Is it quantitative or qualitative? Usually, most of us in clinical field always go for quantitative whatever. But fields like psychology, fields like the social healthcare workers, fields from nursing, usually some of them can also go into the qualitative aspect. Dr. Chichiami is trying to give us the Pico. So as he's trying to do it, can we also be looking into this chart and trying to itemize it on our own so that we can compare and see, are we going to accept this all now or we're going to also turn it down? That is what science is all about. There's always
another one. Sorry to interrupt. I think there is also another one from Buhari. He asks, what is the current molecular status of and the global distribution of invasive Sphagnum species? As a research question.
Now, he has two questions in one. Okay? Buhari gave us one. What is the current molecular status and global distribution of invasive Sphagnum species? So two things, molecular status and global distribution. Now, if you look at what he's trying to do, is that quantitative or qualitative? Buhari, are you with us?
Yes, doctor, I'm here.
Yes, please. Now, if you look at the way you have coined the question,
yes,
is that the answer you're looking for? Is it you want to quantify something or you want to explore those things?
Oh, I think it's the two things at the same time. At the same time, I want to explore the molecular status, which I think it can be as be looking at qualitative, while the global distribution will be looking at the quantitative aspect, I think.
Good. Now, unfortunately, in a systematic review, you don't do mixed study.
Wow.
So what you're supposed to do is, like I mentioned, we need to answer a specific question to give you a specific answer.
Yes,
so
but in this case, they are somehow related because we can only know the global distribution through knowing the molecular status.
Okay.
I will still recommend going with the quantitative because it's basically what is obtainable in the primary studies. So if that's how the primary studies assess it, which I assume in your field is more rather than experiences.
That's true.
So yeah,
yes,
mostly in this case, you can still use the Pico, but the only thing is you wouldn't have a comparator necessarily.
Okay, I understand.
So with this question you have, can you help us also give us the Pico so that other listeners can see how it's if it's easy to develop the Pico? We're waiting for Dr. Tijami's Pico too.
Well, to be honest, actually,
I did send you my Pico, is in the chat.
Okay, okay. Buhari, you're trying to make something?
Yes, actually, I was a bit distracted while we were explaining the Pico, so I think I was a bit confused, just like the previous. I think Aisha asked the question.
I raised that caveat before I started. I said, if we don't pay attention and we miss one side, we are going to miss almost every other side. So you can see that.
Yeah, but I think along the way I can understand if Dr. Chutiami is explaining.
Yes,
I will try to focus on his explanation for his Pico.
Yes, okay. Now let's look at his question. He said, how effective is regular hand washing compared to social distancing? So don't forget 2 interventions that have been designed by the WHO to help reduce susceptibility to SARS-CoV-2, you know, because don't forget the infection is the SARS-CoV-2 while the disease it caused is the COVID-19, so that we don't mix it up. Now, here we have 2 interventions, hand washing and then social distancing. He said his P what? Which population is he looking at? The healthcare workers, the frontline health professionals. So he gave us it as the P. Now, he had 2 interventions, which is one is hand washing and the other is social distancing. So let's understand when you are putting these 2 things in your question, always remember that the first intervention you put is your primary intervention of interest. The second one is your comparator. Are we together, please?
Yes.
Now, if you see, he said his I is hand washing because the I came first. The hand washing came first. So the social distancing is the comparator that he's trying to do. Now, one thing we should know is that in the context of, what do you call it? The WHO guideline to prevent and protect yourself from SARS-CoV-2, hand washing and social distancing are not mutually exclusive. You can't take them as a single intervention on its own. I'm sure Tutiani gave us this just to give us a concept or just for us to understand the Pico. But I'm bringing this especially for us in the clinical field. You cannot use an intervention which is not a standalone with something a comparator, because washing hand, social distancing are all in the package, okay? So we cannot take one and say we want to compare with others. But here, for just the sake of this presentation, I don't want us to go home with this and then we think it's what we should be doing. Tutiamitu is not doing it. He just gave us this for, for the class sake, please.
Okay, so, sorry to interrupt, Doc. Yes. I think it's already time, so we can say that we have already proceeded to the Q&A session, if that is the case, because we have already passed about 7 minutes after the hour that we assigned for the presentation. So I think,
okay.
Can we say that we have already proceeded?
You are keeping time. But Aisha has a question here. Aisha is asking, how does the rise in agricultural food prices affect the consumption pattern of consumers in northern Nigeria? She felt,
and there is also Halima that is raising hand. So that's what I'm saying. We can simply now say that we have proceeded to the Q&A session. Maybe another time we will assign another time for the Corbidence software, so that we can see how to utilize the Corbidence software for the conduct of systematic review.
Yeah, that's fine. I think it's okay. We can just move to question and answer. But the question there, Dr. Chichami, Aisha is pleading with you to do
Yeah, that's fine. We will do the Pico, just attend to Halima. I will
but let's attend to Halima. Can you give her the opportunity to speak? Can we unmute her if you can hear us?
Yes, Halima, you can unmute from your side.
Halima, can you get us, please? You can unmute yourself and talk and ask your question.
Okay. Sorry, I wanted to ask about the Pico, but I've got it now. It's okay.
Thank you. This is where I've been saying that we should not allow us to leave any person behind. If you miss one of the steps, you won't be having problems as we move together. I hope you realize we had 2 Picos, the quantitative and qualitative. Halima. Hello, is she with us? Okay.
Yes, I'm with you.
Okay, did you get the two different Picos?
Yes,
One is for quantitative and the other is for qualitative.
qualitative. Yes, yes.
It's fine. So we can make progress. Dr.
Thank you.
Chitiami, please.
Yeah, so I was just thinking we can say obviously from the question that Aisha posted, so
Yes.
our population is crystal clear. We can say it's consumers in northern Nigeria.
Population is the consumers in northern
Yeah,
Nigeria
because
specifically.
it's very clear, yeah.
It's very
Northern
clear.
Nigeria, whoever is consuming. So and now we
Consumers.
need to see, okay, what is she trying to find out?
Yes.
So rise in agricultural food prices affect the consumption pattern. Affect
So please, before you continue this, I want all of us to understand from the question of how. You will see it's an exploration.
So that you know which direction.
When you say how, it's something about qualitative. And you can see we're not talking about the population of interest, phenomenon of interest, and an outcome of interest. So we'll not be talking about the intervention, disease, no. You can see she gave us something separately. So I want to thank Chutiami so much. Can you just put it on writing so that Halima can also see it crystal clear the way it is? Sorry, Aisha, go. Is that Aisha's question? Yes, Aisha.
Okay, so as we were saying, obviously, I think everybody will believe the population is clear, no problem with that. So now what is the interest? Because if you look at it from the PIC perspective, I mean PIO perspective, which is the population interest and then the outcome. So you can see that the I is the interest. That is what she wants to find out or what she is interested to explore.
Yes, the phenomenon of interest.
Exactly, phenomenon of interest. So that is the raise input prices. So, and then now still it doesn't make sense. What did she want to see at the end about this phenomenon of interest? What does it lead to? Does it really change? Does it increase, decrease? So this is the outcome, obviously. So again, we don't necessarily have to make it with
a comparator there.
Exactly. So we can
you don't
just
need a comparator.
Exactly. So we can just use the PIO. Consumers' interest is raise input prices, and then the outcome will be the consumption pattern.
Now, let us understand this.
So it's more or less.
Let us understand this. The question Aisha is putting forth is often not suitable for a review. It's more for a prospective study. Meaning, it is now we want to study them. Do you understand?
Yeah.
Don't forget, the review is to re-examine what has happened. Okay? So I'm sure Alima is worried with what is happening in the present. So the question, yeah, the question will be on how do we monitor them and follow them to see how does the increase in price change their consumption pattern? For instance, I'm used to eating 2 shawarmas when it was 500 naira. Now shawarma is 1,000. I may not be eating shawarma maybe once in 1 week again. You know, so these are patterns we want to look for. But it is not a retrospective thing. So we must find how to coin a question that will depict you're trying to find an answer what was there before now. For instance, let me still go back to her question pattern, and I will say, sorry, yes. How does the rise in agricultural food prices between 1990 and 2010 affect consumption? You know, so I've pulled the thing backward. Because if you are talking about it this way, it will be looking as if you want to find out in the present. So you must coin the question to show a reflection of something which has passed. Aisha, I don't know if you are getting me this way.
Yes, sir, I didn't want to interrupt you. I was leaving messages for you in the chat box.
Oh, okay.
Yes.
Yeah, I think I can see her question from the angle she's talking about. So it's possible to have retrospective data to show the crisis in those days, maybe 5 years ago, and then, so as long as, I think one thing with the systematic review, as long as you have existing primary study that does the comparison, can still do it.
That's right.
The only thing is you cannot go and collect raw, fresh data. It has to be done.
Okay, that clarifies. So it has to do with secondary data, not primary data.
Definitely.
Always.
Okay. So any other question? Sorry, Dr. Abdulkader Isa, we are sorry. We have gone beyond your time. He said he gave us 1 hour. And,
no, it's okay. It's very interesting. We are enjoying.
I think
presentation.
it's the first day, so we should expect things to go like that. I think from next time we can try to adjust and work with the time.
Yes. So I have a question, Doctor.
Yes, please.
First of all, thank you very much for the wonderful presentation. And even though I'm really looking forward to the Covidence software, like for the usage of Covidence software to conduct the systematic review, but as Dr. Mubarak said, so probably we need to organize another session for specifically for the Covidence software. But for now, my question is, earlier you said the minimum years to conduct systematic review is like 5 years, right?
No, 15 months.
15 months. Oh, okay.
It's just,
so
I'm sorry, that place, what it means is to conduct, complete, submit, and then it comes out of publication.
No, I mean not the process like for doing the systematic review, but I mean the analysis.
To update another systematic review on the same question, right?
Exactly.
Yes, to update. That's an update of a systematic review. 5 years is what is given in the guideline.
Yes, but in this regard, for example, if it is like 5 years, then obviously you need to revisit the previous publications, or you need to revisit the previous reviews. So in this regard, there is going to be some kind of repetition with the previous works and then your works, because you have to give a base for your review before you add your contribution to the whatever question you are trying to address.
Yes.
And this is my first question.
Yes.
Then my second question goes like this. Actually, I have seen a lot of review papers, which to me is kind of somehow, and then they finally been published in good journals. The question is like this: how are we going to use the previous data in order to use in our systematic review? Are we going to use the same like figures, tables, and sometimes even a huge chunk of writings in the same systematic review that they use in the previous one, or we are going to analyze all the previous data, form our own figures and tables to use in our study?
It will be different, no?
This is my question, Doctor.
Yes, thank you so much. They are a very interesting question. Recently, myself, Abdulkader Megoro, and Mubarak, we are doing, this is just a scoping review anyway. While we're doing the review and we're beginning to lag behind, before we know it, somebody published the same type of our talk. You can imagine. So it means you don't have time to waste. As you're thinking like this, and other people are also thinking the way you're thinking. Now, when we saw that publication in this February 2022, what we have to do is look into their limitations and look at our own work from an angle they didn't look at theirs. So we are able to come up with something different. Now, coming back to your question, when you do a systematic review, you want to update for 5 years. Of course, the argument and justification is that Abdul Qadir 2015 did something on this thing. And of course, according to the systematic review guideline, it is mentioned that one can update a same question after every 5 years. Now, this is a justification why you're doing it. So by the time you are going into the databases, already during your inclusion and exclusion criteria, you are going to remove everything that is below 2015. 2015 down is not in your work. Because that work that was published last was published in 2015. So everything you are bringing up new now has nothing to do with what they have. But already the work is the basis of yours. So you have their conclusion, the recommendations, what they have mentioned. So you're going to be talking about the new things you came up with. How do they differ from what is known? Because already you know what they have. How many new publications have been added? The new publications, do they come up with different designs than what type of designs that were mentioned before? Now, we also want to look at the quality. So many things you have done and compared to what was there before. And at the end of the day, they're giving us a new information that a systematic review evidence. Is this still tenable? Is this still what we can be using, or what we have updated have come with something that contradicts what he has said? So all these are the reasons for update. So it's not the same thing. Now, the second question, if I'm correct, if I got you correctly, you're saying, how do we pull this data together? Now, and that is why I'm not too interested in going into confidence. In fact, we have not talked about Prospero registration fact. When you develop your protocol, the first thing when you go to register on Prospero is to put in your title and search. Is there any person that is doing the same thing you are doing? Already, if it shows you a systematic review is ongoing, then you have to cancel your own. It will not be registered. So this is something else. I don't know if I got your questions correctly, Dr. Buhari.
Yes, I think you got it. But in addition, it's just for the figures and tables that you are going to that they are going to represent your review.
Yes.
So
Yes.
how are you going to fold them together? Like you're gonna use the previous ones, or you are going to form everything by?
No, you are not going to
based on
use
your
any other
understanding.
person's table. Your table is your own table. Now, this depends on the data you have extracted. And that is why systematic review, you must have a protocol developed. Under that development of protocol, you will have to state, even before you started, how do you want to extract your data? What type of data you're going to extract? How are you going to manage that data? So by the time you are coming to manage your data and giving us narrative synthesis, it is the picture of what did you really find out that will prompt you to understand this is the design of the table or figure I'm going to be talking about. So I think we are very, very, I don't want to say over ambitious about the systematic review. Somebody is already taking us to the end, while we are still at the beginning. Buhari's question is always at the end of what we are doing. So I think
sir, that's what I want to say. That's really what I want to say, is because maybe we couldn't discuss data extraction and appraisal. Maybe that's why all these questions are arising, because in systematic review, when you are done with the systematic review, you are going to do data extraction from the study that you got that meet your criteria, and then you are going to do what we call appraisal for the study. So maybe it's because we didn't reach to that stage.
No,
that's why
I've told you, I have everything in this slide. I will be happy to share the slide so that people can have it. What I'm trying to say is that we must go gradually. Usually systematic reviews, when we come, I don't even do presentation, it's a workshop we normally do. So that people can have a face-to-face and practical sessions. This is how you will appreciate and understand how to handle all these things. Like from this stage, we're supposed to go to the stage of protocol development. How do we develop a protocol? But we cannot develop a protocol if we don't have a standard and clear research question. You can see how we've been struggling with research questions since. So until we get the research question clear, then we are not going to be able to make any product. Otherwise, you will get stuck. You know that confidence is about, now you have gotten your search, now bringing it into confidence and then managing it. So it means I can't go and be talking about confidence until I know how to even do my search, until I know how to pull this data together. So please, I want to crave your indulgence that I think in 100% of what we're supposed to learn in in systematic review, I can only tell you we have learned maximum of 20 to 25% today. Chitiami, I don't know if I'm wrong.
You are right. You are right.
Okay. So I think, thank you very much, Doctor. So I think what we should do, clearly, we need to organize another session, probably maybe 2 more times, in order to thoroughly explore this aspect. So since the time has already been taken, I think Dr. Mbara, we can try to conclude, and then inshallah we need to organize another one so that Doctor, you will continue from where you stopped.
Inshallah. Aisha is raising her hand. Please, can we give her an opportunity to speak?
I don't think we have much time. Maybe
Sorry, let Aisha just ask her last question.
Okay, Aisha, please.
Thank you, Dr. Bello. Actually, it's just a suggestion. Please, I know you are in the medical field. I don't know, subsequently, if you can bring in socioeconomic examples for us socioeconomists so that it will be relatable. Because at first it was still abstract because of the medical terms and medical examples. So it was later I started understanding. So thank you so much for your time and everything.
All right, inshallah, Chutiami is there. He has some social determinant of health too. We'll bring it up.
Okay, yes. I think it's already time, and for this session, I can say that the take-home points that we should all have at the graphs of our finger are the process for conducting systematic review. The doctor mentioned about 8 processes for conducting systematic review, and I'm going to say it quickly. Formulating the research question, develop a review protocol. 3rd, identify a relevant study. 4th, assessing the eligibility. 5, data extraction. 6, appraisal. 7, synthesis of the studies. And 8, knowledge translation. So this is a take-home point. I would like to thank you, Prof, for this wonderful session. Like I said at the beginning, you will get to enjoy the wonderful person in Prof, and I can testify that you enjoy this session. So I would like to thank you all for joining us. We look forward to seeing you next time. Thank you.
Thank you very much.
Your final word, please. Your final word, Prof.
Well, I want to thank everybody. It has been quite a learning process. That's how we meet in class. We learn from our students will learn from us. At least I'm happy I've been able to learn something from Aisha, that how should I be looking at consumption? I just remembered some of the things my boys will say, shawarma. So increasing in price must change shawarma. So at least I've learned that one today. Aisha, thank you so much. Chutiami, I also want to thank you for being there. At least he has been helping to remind me I should not fall out of track. Buhari Abdulkadir, of course, they are taking it at microbiology level. You know, it can be very difficult seeing those microbes. But luckily, he said it's resistant. So we are trying to also resist whatever you come up with. I hope we'll be able to share more knowledge subsequently. And I think I'll always be ready to give him my best, inshallah. Thank you all for coming.
Okay, thank you. I think we can
Yeah,
call it.
I have some few things to say, Dr. Mubarak.
Okay.
Okay, thank you very much, Dr. Bello and Dr. Mubarak. And for the also participant, thank you very much for coming to this wonderful session. As you know, the session has already been recorded and you can find it in our YouTube channel, that is Gamji Educational and Mentorship Forum. Likewise, you can search in our Facebook page also. You can find the recorded video there. Also, if you haven't joined or like all our social media handles, so you should do so, so that you will be able to subsequently be in contact with all our programs. So thank you very much, doctors, and thank you very much, everyone.
Okay, thank you, Doc.
Thank you. Bye.
Bye.